Hey, Dr. Brian Anderson here. We're just going to start our first segment on Ask the Doctor. So we get a few questions coming in from you guys each week. Just wanted to answer some of those for you here today. Our main focus is going to be on peptides. So peptides are one of the hottest treatments out today. We get a lot of phone calls, a lot of emails about them. We were one of the first offices here in North Florida to offer them as well. So there are many different types of peptides. Peptides in general are proteins or amino acid sequences. So that in general, that's what a peptide is. So I'm going to go to a couple of questions here. If you guys have questions, give our office a call. Be happy to answer those, or shoot us an email. We'll include a email address in the video afterwards. Peptides have been making headlines. What do they treat, and what sorts of things are peptides indicated for? Well, peptides can be indicated for things such as fat loss, accelerated aging, skin health, also things like musculoskeletal injury, so arthritis. Some peptides are being used for GI disorders such as IBS, UC, Crohn's, etc. We treat a lot of athletes here. We treat a lot of folks that are looking to improve their quality of life, slow down that aging process. So peptides are certainly a tool that we use for that every day. So first question, what exactly is a peptide? So going back to that again, peptides are simply amino acids. We eat amino acids every day, and this amino acid sequence in general, especially when it comes to a growth hormone secreting hormone type peptide, these peptides signal other hormones to be produced in the body. So for instance, CJC-1295 and Ipamorelin, those are used to increase growth hormone levels in the body. So we used to prescribe growth hormone a lot, and growth hormone, as you may know, has a lot of side effects. So many side effects that I don't prescribe them anymore due to that side effect profile. What's good about a peptide, in particular CJC-1295 and Ipamorelin, is they're a much more elegant solution to low growth hormone. So we're also talking about low growth hormone in adults. So we do not treat pediatrics with these sorts of peptides. So the way that those peptides work, those peptides enable secretion of higher levels of growth hormone in the body when taken. Now, peptides can be administered a number of different ways. We have an oral form. There's also a subcutaneous injectable form. There are also other peptides specifically for injury, like BPC-157. And BPC we've been using a lot, especially with our professional athletes with chronic injuries. We want to keep them out of the operating room. We want to keep them active and pain-free. So in general, that's what a peptide is. It's a protein. It's a amino acid sequence. Let's see. So what are two of the most popular peptides that we use? So there are a number of peptides that we use. The two most common ones that we use, especially with low growth hormone, would be CJC-1295 combined with Ipamorelin. And the reason why they're combined is they both interact with the body in a different manner. The idea behind putting them together is that the sum of those combinations are greater than their parts. So they work very well synergistically. CJC-1295 is a 29 sequence amino acid, and it's a peptide. It's an injectable protein. There's also an oral form of that. CJC is really good with body fat composition. So if you were hanging on to excessive body fat, it helps with metabolism of fat. It also helps with looking good as far as skin health, skin quality, and it also helps a lot with sleep. So those are some of the main things. A lot of people will also say that CJC-1295 enables them to recover faster from a workout. So those are some things regarding CJC-1295. It's also referred to as DAC-GRF. So if you want to get into the science and look that up, that's something you can check out. So getting into ipamorelin, ipamorelin also stimulates growth hormone release. Ipamorelin is great because it really targets inflammation in the body and also wound healing and muscle healing. So if you have chronic arthritis, tendinopathy, tendinitis, tendon tears, it can help with improvement in many cases. So CJC-1295, not as good of a peptide for those sorts of things. Ipamorelin is better. The other thing about ipamorelin is there has been some research demonstrating that it can increase testosterone production to some degree. So that's also helpful in some cases. Now, we have another question about side effects. So potential side effects from peptides. All medications have potential side effects. So aspirin, Tylenol, even some of the most basic medications, they all unfortunately do have side effects. So what are some of those? Well, the most frequent side effect would be if you're doing an injectable based peptide versus the oral form of the peptide would be injection site soreness. And that happens. And I think usually with any type of injection that I prescribe, some percentage of people will have injection site soreness. That's kind of a no-brainer. But some of the ones more specific to peptide treatments are headache, nausea, vertigo, which is a spinning sensation. Some people will report vivid dreams. And I think one potential reason or possible reason for that is growth hormone secretion. We're simply augmenting that. So our growth hormone naturally in the body goes up at night when we sleep. So a lot of people after starting a peptide treatment will notice that they're sleeping more soundly. So I postulate that with that sound sleep may come more vivid dreams. So just throwing that out there. What other things can peptides help with? Peptides can help with regulating blood pressure. Peptides we use sometimes post-surgically. So if someone has a rotator cuff repair or a knee scope, sometimes we'll use peptides to help people heal faster. Other things that peptides are used for, we don't treat a lot of these sorts of ailments, but certainly they're being used. One would be GI issues. So I alluded to Crohn's and IBS earlier. So there are a lot of GI specialists, a lot of people on the cutting edge of medicine really researching this as an alternative to some of the other medical treatments for those conditions. So those are the questions that we have for this week. If you have questions about the peptide, if you would like to see if you might be a candidate for peptide treatment, give me a call, come into the office, be happy to help. There's some good research online as well on PubMed. If you're interested in checking that out, just a resource for you there. Our office number, if you're interested in learning more, is 904-874-5775. Until next week, see ya.